For what purpose does the gentleman from Oregon seek recognition?
Mr. Chairman, I have an amendment at the desk.
The clerk will designate the amendment.
Amendment number 3, printed in the congressional record, offered by Mr. Blumenauer of Oregon.
Pursuant to House Resolution 736, the gentleman from Oregon and a member opposed, each will control 5 minutes. The chair recognizes the gentleman from Oregon.
Thank you, Mr. Chairman. I would yield myself 3 minutes.
The gentleman is recognized.
Thank you. Mr. Chairman, one of the great concerns we have is how the 2 million young Americans who were sent to Iraq and Afghanistan reintegrate back into society. They can return with many of them with wounds visible and invisible. We find that more than 20% of those 2.8 million American veterans suffer from PTSD and depression. A recent survey revealed that suicide rates among veterans are roughly 50% higher than among civilians. Another study found that the death rate for opioid overdoses among VA patients is nearly double the national average. What I hear from veterans that I talk to is that an overwhelming number of them say that medical marijuana has helped them deal with PTSD, pain, and other conditions, particularly as an alternative to opioids. And I would argue that it is essential that veterans be allowed access to this as a treatment if it is legal in their state. 24 states in the District of Columbia and Guam have passed laws that provide for legal access to medical marijuana at the recommendation of a physician to treat such conditions ranging from seizures, glaucoma, anxiety, chronic pain, traumatic brain injury, and the symptoms associated with chemotherapy. 14 of these states specifically allow physicians to recommend medical marijuana for the symptoms of post-traumatic stress, PTSD. As a result of these medical marijuana laws, more than 2 million patients across the country, including many of our veterans, now use medical marijuana. Unfortunately, the Department of Veteran Affairs specifically prohibits its medical providers from completing forms brought to their patients seeking recommendations regarding a veteran's participation in a state medical marijuana program. What this means is that those patients who want to pursue medical marijuana have to go ahead and hire a physician out of their own pocket, not dealing with the medical professional of their choice, the medical professional, their VA doctor, who knows them the best. I think that is unfortunate, and we have an amendment co-sponsored by Dr. Joe Heck, Sam Farr, Dana Rohrbacher, Dina Titus, Tom Reed, and others that would prohibit this funds from being made available to the VA to implement this prohibition. I think it's the right thing to do for our veterans, to be able to treat them equitably, to enable them to have access to the doctor that knows them the best, giving them better treatment and saving them money. And I would respectfully request that we approve this amendment to eliminate this unjustified prohibition, and I reserve the balance of my time.
Gentleman reserves. Any member claiming time in opposition?
I think.
Gentleman from Pennsylvania.
Yeah, Mr. Chairman, I rise somewhat reluctantly to my friend in opposition. He's very genuine, sincere, very thoughtful member of this body. I understand that the country is evolving on this issue, as many states, and including my own, have moved forward on medical marijuana. As a member of this House, I'm a bit uncomfortable, however, in trying to dictate policy on marijuana without guidance from Food and Drug Administration, National Institutes of Health, and other medical professionals. That said, I reluctantly rise in opposition.
Gentleman reserve. Gentleman reserves. Gentleman from Oregon.
I'm prepared to I'm going to close when you've exhausted your speakers.
The gentleman from Georgia is recognized. Strike last word. You're recognized for 5 minutes.
I support the amendment that's offered by Mr. Blumenauer. Last year in Georgia, the General Assembly passed and Governor Deal signed legislation that immediately legalized the use of medical marijuana to treat serious medical conditions. Georgia became the 36th state, plus Washington, D.C., to legalize marijuana extracts to treat illnesses. I believe that we should not limit the Veterans Health Administration in providing optimal pain care for our veterans. If medical marijuana is legal in a state, then the VA should be able to discuss that treatment option and allow the veteran to make his or her own choice. I believe that the VA's published policy guidance related to the use of medical marijuana by veteran patients, VHA Directive 2010-035, medical marijuana, has become outdated. I believe supporting a veteran's right to use alternative methods to deal with pain is the right thing to do. With that being said, I support the amendment and I urge its adoption.
Gentleman from Georgia yields back. Gentleman from Oregon. Gentleman from Pennsylvania. Gentleman from Pennsylvania.
Mr. Chairman, as I said, I reluctantly oppose the amendment, and I yield back at this time.
Gentleman yields back. Gentleman from Oregon.
Thank you very much, Mr. Speaker. There's nobody that I have more respect for than my friend, the chairman of the subcommittee. But I take modest exception. This amendment does not dictate treatment options. It's not interfering. It's not superimposing anybody's judgment about the merits of marijuana. It simply enables VA doctors and patients to interact with state legal marijuana systems that this Congress has repeatedly supported through amendment votes, just like everybody else. We should not be limiting the treatment options available to our veterans. I fail to understand what the basis is to force in the state of Pennsylvania veterans who feel that they need to avail themselves to medical marijuana like any other citizen in Pennsylvania or in Oregon has a right to do, but force them to not use the doctor that knows them best, instead to go to somebody else, hire them out of their own pocket, and be engaging with somebody who doesn't know their full range of activity. This doesn't engage the Veterans Administration. There's no marijuana on premises. It simply allows the doctor to be able to deal with the veteran as a patient, to be able to counsel and potentially prescribe them like any other person in any other state where it's legal. Bear in mind that these people are suffering from PTSD, chronic pain, depression, conditions that medical marijuana is legally entitled to treat, and which veterans that I have met with, literally from coast to coast, say has transformed their lives. And what we're doing now, they're dying at a higher rate than the average member in the population. The suicide rate is high. The opioid addiction rate is almost twice as high as the average citizen. I think that's unconscionable. We should have this amendment to try and help address it.
Gentleman's time has expired. All time for debate having offered. The question is on the amendment offered by the gentleman from Oregon. Those in favor say aye. Aye. Those opposed, no. Being the chair, the noes have it. The amendment. Gentleman from Oregon.
On that, I would request a recorded vote.
Pursuant to Clause 6, Rule 18, further proceedings on the amendment offered by the gentleman from Oregon will be postponed.